Have you ever taken your blood pressure medication exactly as prescribed and still felt like something wasn't quite right? Maybe your ankles started looking a little larger by the end of the day. Maybe you developed a strange cough that wouldn't go away. Maybe you felt dizzy standing up, tired for no clear reason, or noticed your energy wasn't what it used to be. And because you're over 60, you told yourself the same thing millions of older adults tell themselves every year. It's probably just age. But what if it isn't? What if one of those symptoms is actually your body trying to tell you something important about the medication you've been taking every single day? If you're currently taking Amlodipine, Losartan, or Lisinopril, today's conversation could be one of the most important health discussions you hear this year, because these medications help millions of Americans control high blood pressure and protect their hearts. But there are warning signs, side effects, and hidden mistakes that many people never fully understand until a problem develops. And here's what concerns me most. The people who struggle with these medications are usually not careless people. They're responsible people, people who never miss a dose, people who follow instructions, people who genuinely want to stay healthy. A few years ago, I met a 73-year-old patient named Margaret. Margaret kept a notebook of every medication she took, every blood pressure reading, every doctor's appointment. She was organized, disciplined, and determined to take care of herself. On paper, everything looked perfect. Her blood pressure numbers were improving. Her doctor was pleased. Her family was relieved. But behind the scenes, something else was happening. By the end of each day, her shoes felt tighter. Her legs felt heavier. And she was becoming increasingly worried that something serious was wrong with her heart. What Margaret didn't know was that the answer had been sitting in her medicine cabinet the entire time. And she's not alone. In this video, I'm going to walk you through some of the most important things seniors should know about Amlodipine, Losartan, and Lisinopril. We'll talk about the symptoms people ignore, the warning signs people misunderstand, and the medication mistakes that can quietly create problems months before anyone realizes what's happening. But stay with me until the end, because the most important lesson has nothing to do with your blood pressure number. It has everything to do with whether your medication actually fits your body and your life. Before we continue, let me know in the comments, which medication are you currently taking? Amlodipine, Losartan, Lisinopril, or something else? And if you enjoy practical health information designed specifically for adults over 60, be sure to subscribe and turn on notifications. Now, let's begin with the first hidden truth that catches thousands of seniors completely by surprise. Before we talk about side effects, I need you to understand something that most people are never told clearly. Amlodipine, Losartan, and Lisinopril all have the same goal: lower blood pressure, but they do not work the same way. And that matters more than most people realize, because when people think all blood pressure medications are basically identical, they often misinterpret the signals their bodies are sending them. Think of it this way. Imagine 3 different mechanics trying to solve the same problem with your car. One adjusts the engine, one adjusts the fuel system, and one adjusts the transmission. The goal is the same, but the process is completely different. That's exactly how these medications work. Amlodipine helps relax and widen blood vessels. Lisinopril works through a hormone system that affects blood vessel tension and fluid balance. Losartan targets a similar system, but through a different pathway. Same destination, different roads, and because they take different roads, they create different side effect patterns. This is where many seniors get confused. A symptom appears. They notice something feels different. But because nobody explained what to watch for, they start guessing. And guessing is where trouble begins. Let me tell you about Richard. Richard was 76 years old and had recently started a new blood pressure medication. A few weeks later, he began noticing changes in his body. Nothing dramatic, nothing painful, just different. His first thought was that he was getting older. His second thought was that maybe he wasn't exercising enough. His third thought was that perhaps he needed to drink more water. What never crossed his mind was that the medication itself might be involved. And that's the problem. Most people are prepared to take the medication. They're not prepared to understand it. When patients don't understand the pattern, they often make one of 2 mistakes. They ignore symptoms that deserve attention, or they panic over symptoms that are actually manageable. Neither response is helpful. The goal is not fear. The goal is awareness. Because once you understand how these medications behave, you stop being surprised by your body. And when you're no longer surprised, you make better decisions. You ask better questions, you recognize warning signs earlier, and you avoid many of the mistakes that send people into unnecessary medical problems. Now let's talk about the first medication on our list, because one of its most common side effects causes thousands of seniors to worry about the wrong thing every single year. And it often starts with something as simple as a pair of shoes feeling tighter than usual. Now let's talk about amlodipine. And if you're taking it, I want you to pay very close attention to this section, because one of the most common side effects of amlodipine is also one of the most misunderstood. It often begins so gradually that people don't connect it to the medication at all. A shoe feels tighter, a sock leaves a deeper mark around the ankle, a pair of pants feels a little snug around the lower leg. At first, most people ignore it. Then they start worrying, am I gaining weight? Is something wrong with my heart? Are my kidneys getting worse? Those questions are completely understandable, but sometimes the answer is much simpler. A few years ago, I met a patient named Linda. Linda was 74 and had started taking amlodipine about 2 months earlier. Her blood pressure numbers looked fantastic. In fact, they were better than they had been in years. But every evening, she noticed something strange. Her ankles looked larger than they had that morning. Not dramatically larger, just enough to make her uncomfortable. She assumed it was part of getting older. Then she thought maybe she had been eating too much salt. Then she became convinced something was wrong with her heart. By the time she came into the office, she was genuinely frightened. What Linda didn't realize was that amlodipine can sometimes cause fluid to collect in the tissues around the ankles and lower legs. And here's why this side effect confuses so many people. The swelling often appears when everything else seems to be going right. Blood pressure improves, energy may feel normal, lab work may look fine, yet the ankles continue getting puffy. That's why so many seniors assume the problem must be something else. Now listen carefully. Not every swollen ankle is caused by medication. And not every person taking amlodipine develops swelling. But if swelling appears after starting the medication or after increasing the dose, it deserves a conversation. Not panic, a conversation, because sometimes a simple adjustment can make a huge difference. What worries me most is not the swelling itself. It's what happens next. Many people become frustrated. They stop taking the medication without telling anyone. Or they start skipping doses before social events because they don't like how their legs look. And that's where blood pressure control begins to fall apart. The symptom wasn't the real danger. The silence was And unfortunately, amlodipine isn't the only medication that creates this kind of confusion. Because the next medication on our list causes a symptom that many people mistake for allergies, a cold, or even aging itself. And some seniors live with it for months before they realize what's actually causing it. And now we come to Lisinopril. If you're taking this medication, what I'm about to tell you could save you months of frustration. Because one of the most common side effects of Lisinopril doesn't always show up right away. And that's exactly why so many people miss it. Most people assume medication side effects happen within a few hours or a few days. Sometimes they do, but not always. Lisinopril has a reputation for causing a dry, persistent cough. And here's the tricky part. That cough can appear weeks or even months after the medication is started, which means many people never connect the two. Let me tell you about Susan. Susan was 69 years old and had been taking Lisinopril for nearly 4 months. Everything seemed fine. Her blood pressure had improved. Her doctor was happy with her progress. Then one evening she noticed a slight tickle in her throat. Nothing major, just a little irritation. A few days later, she was clearing her throat more often. Then came the nighttime coughing. Not a severe cough, not a chest infection, just a dry, nagging cough that refused to leave. Susan blamed spring allergies. She bought allergy medicine. No improvement. Then she blamed dust in the house. She changed air filters. Still no improvement. Next, she thought maybe acid reflux had returned. Weeks passed. The cough continued. Her sleep became worse. Her energy dropped. And she began feeling exhausted most mornings. When we finally reviewed her medications, one question changed everything. When did the cough start compared to when you started Lisinopril? The room went quiet. She had never considered the connection. And that's exactly what happens to thousands of seniors every year. They spend months treating the wrong problem, not because they're careless, because nobody explained what to watch for Now I want to make something very clear. A typical Lisinopril cough is usually annoying. It is usually not dangerous. The dangerous symptom is something completely different. If you ever develop swelling of the lips, tongue, face, or throat, especially if swallowing or breathing becomes difficult, that is not something to monitor at home. That is an emergency. Fortunately, this reaction is uncommon, but knowing the difference matters. Because a dry cough and throat swelling are not the same thing. One may require a medication discussion. The other may require immediate medical attention. And this brings us to another hidden issue that many people never see coming. Because the next risk doesn't usually begin in the medicine cabinet. It often begins in the grocery store. And it can quietly affect the rhythm of your heart without obvious warning signs. Now let's talk about Losartan. And honestly, this may be one of the most overlooked medication conversations in America. Because the danger I'm about to describe doesn't usually come from the pill itself. It often comes from something people buy at the grocery store every week without thinking twice. The issue is potassium. Now, when most people hear the word potassium, they immediately think, that doesn't apply to me. I don't take potassium supplements. But that's where the misunderstanding begins. Potassium doesn't just come from supplement bottles. It's hiding in places many seniors never expect. Salt substitutes, electrolyte powders, sports drinks, heart-healthy seasoning blends, meal replacement products, and certain nutrition drinks marketed toward older adults. Many of these products contain significant amounts of potassium. And if you're taking Losartan, or sometimes Lisinopril, too much potassium can become a serious issue. Why? Because potassium plays a major role in controlling the electrical signals that keep your heart beating properly. When potassium levels drift too high, the heart may not function normally. The problem is that high potassium doesn't always announce itself loudly. Sometimes the symptoms are subtle. Fatigue, muscle weakness, cramping, pins and needles, sensations, skipped heartbeats, occasional fluttering in the chest, or sometimes almost no symptoms at all. That's what happened to George. George was 77 and trying harder than ever to improve his health. His doctor told him to reduce sodium, so he did exactly what many responsible people would do. He replaced his regular table salt with a salt substitute. He felt proud of himself. He believed he was protecting his heart. What George didn't realize was that the salt substitute he was using contained large amounts of potassium. So every day he was adding extra potassium to meals, while also taking Losartan. At first, nothing seemed wrong. Then he began feeling unusually tired. A few weeks later, he noticed occasional muscle weakness. Then came a strange fluttering sensation in his chest. When blood work was finally checked, the explanation became clear. The medication wasn't the problem. The potassium overload was. And what makes stories like George's so frustrating is that he wasn't being reckless. He was trying to be healthy. He was trying to follow the rules. Nobody had simply connected the dots for him. That's why I always tell patients this. If you're taking Losartan or Lisinopril, never assume every heart-healthy product is automatically safe for you. Read labels, ask questions, and keep up with your blood work, because some of the biggest medication problems don't come from breaking the rules. They come from following incomplete information. And speaking of hidden dangers, the next one catches people when they're sick, dehydrated, and least prepared to see it coming. And that's exactly what makes it so dangerous. Now we come to one of the most important lessons in this entire video. And it's a lesson many people don't learn until after they've already had a frightening experience. Dehydration changes everything. Let me say that again. Dehydration changes everything. Because a medication that works perfectly well on a normal day may affect your body very differently when you're sick, losing fluids, or unable to eat and drink normally. This is especially important if you're taking Losartan or Lisinopril. Imagine this. You catch a stomach virus, you're vomiting, you have diarrhea, your appetite disappears. Maybe it's a hot summer week and you're sweating more than usual. Or perhaps you're simply not drinking enough water because you don't feel well. Your body's fluid balance begins to change. But many people keep taking their medication exactly the same way they did when they were healthy. And that's where trouble can begin. I remember a patient named Frank. Frank was 78 years old and incredibly disciplined. He never missed a dose of medication, not once. In fact, he was proud of it. Then one winter he came down with a severe stomach bug. For 2 days he could barely keep food or fluids down. But every morning, right on schedule, he continued taking his Losartan. Because that's what responsible patients do. Or so he thought. On the third evening, Frank stood up from the couch and immediately felt the room spin. His vision blurred. His legs felt weak. And for a moment he thought he might pass out. Thankfully, he didn't fall. But it scared him badly. When he arrived at the hospital, doctors discovered something important. The medication wasn't suddenly dangerous. His body was dehydrated. His blood pressure had dropped too low. His kidneys were under stress. The environment inside his body had changed. And the same dose that worked safely a few days earlier was now acting very differently. This is what many seniors are never told. Illness changes the rules. A medication plan that works perfectly during normal life may need extra attention during dehydration, vomiting, diarrhea, or serious illness. That's why it's so important to know when to call your healthcare provider for guidance. Not because the medication is bad, but because your body is different today than it was yesterday. And here's what worries me most. Many people believe being a good patient means pushing through no matter what. Taking every pill exactly the same way regardless of what's happening. But good health isn't blind obedience. Good health is understanding when something has changed, understanding when a symptom matters, and understanding when it's time to ask for help, because some of the biggest medication problems don't happen because people ignore their prescriptions. They happen because people don't realize their situation has changed. And speaking of hidden problems, the next one is sitting in millions of medicine cabinets right now. Most people don't even think of it as a medication risk. In fact, many people take it every week without ever mentioning it to their doctor. And that's exactly why it can become dangerous. Now let's talk about one of the most dangerous medication mistakes that almost nobody sees coming. Because it doesn't start with your blood pressure medication, it starts with a pain reliever, a sore knee, a stiff back, an aching shoulder after gardening. Something completely ordinary. Most people never think twice about taking ibuprofen or naproxen. They're available everywhere. Drugstores, supermarkets, gas stations. They feel harmless. And that's exactly why this issue catches so many people by surprise. If you're taking Losartan or Lisinopril, and especially if you're also taking a water pill or diuretic, certain anti-inflammatory pain medications can create problems for your kidneys. Not overnight, not every time, but under the wrong conditions, the risk becomes very real. Here's why. Your kidneys depend on healthy blood flow to do their job. Blood pressure medications affect that system. Diuretics affect that system. And anti-inflammatory pain medicines can affect that system too. Each one may be reasonable on its own, but together, they can sometimes create what doctors call a perfect storm. Let me tell you about Carol. Carol was 74 years old. She took Losartan for blood pressure and a diuretic for mild swelling. Everything was stable. Everything looked good. Then arthritis in her hands began bothering her. Nothing severe, just enough discomfort that she started taking ibuprofen several times each week. At first, nothing happened. Then her blood pressure became harder to control. A few months later, routine blood work showed changes that surprised everyone. Doctors started searching for explanations. Had her diet changed? Had she become dehydrated? Was her kidney function worsening? The answer turned out to be much simpler. Nobody had considered how often she was taking ibuprofen. Once the interaction was identified, her treatment plan was adjusted, safer pain management options were discussed, and her situation improved. But this story highlights something important. The biggest medication dangers aren't always rare side effects hidden in tiny print. Sometimes they're common combinations that nobody thinks to mention. And that's why I always encourage patients to tell their healthcare team about every medication they're taking. Prescription medications, over-the-counter products, pain relievers, supplements, everything. Because your doctor can only connect the dots they know about. And here's something else that many people never realize. One of the most common side effects of blood pressure medication isn't actually a side effect at all. It's a warning sign. A warning sign that can lead to falls, broken bones, and hospital visits if it's ignored. And it often starts with one simple moment. Standing up. Now let's talk about the side effect that many seniors dismiss until it becomes a serious injury. Dizziness, lightheadedness, That brief moment when you stand up and suddenly feel unsteady? Most people laugh it off. I got up too fast. It's probably my age. I just need to sit down for a minute. Sometimes that's true, but sometimes your body is trying to tell you something important. Remember, all three of these medications, Amlodipine, Losartan, and Lisinopril, are designed to lower blood pressure. That's their job. But when blood pressure drops too quickly, or when your body is still adapting to a new medication or dose increase, dizziness can become a warning sign. And in older adults, a few seconds of dizziness can change everything. Let me tell you about Joseph. Joseph was 81 years old and fiercely independent. He lived alone, drove himself everywhere, handled his own shopping, took pride in never asking for help. A few days after his doctor increased his amlodipine dose, Joseph got up in the middle of the night to use the bathroom. As he stood up, the room suddenly tilted. His vision blurred, and for a terrifying second, he felt as though the floor had disappeared beneath him. Thankfully, he grabbed the bathroom sink before falling, but the experience shook him. When we talked later, I asked a simple question. Did anyone explain what lower blood pressure might actually feel like in real life? He paused, then shook his head. He knew the medication could lower his blood pressure, but nobody had explained what that might feel like when standing up in the dark at 2 o'clock in the morning. And that's the difference between receiving a prescription and understanding a prescription. Here's what I want you to remember. Mild dizziness sometimes improves as your body adjusts, but repeated dizziness should never be ignored. Near fainting should never be ignored. Actual fainting should never be ignored. Because falls are one of the leading causes of serious injury in older adults, and many of those falls begin with a moment people dismissed as nothing. Now here's where another mistake creates unnecessary fear. People see one unusual blood pressure reading and immediately panic. A high number means the medication isn't working. A low number means the medication is too strong. Neither assumption is necessarily true, because blood pressure changes constantly. It changes with stress, sleep, pain, caffeine, meals, exercise. Even worrying about your blood pressure can temporarily raise your blood pressure. That's why one reading means very little by itself. What matters is the pattern and the trend, the story your numbers tell over time. And that lesson leads directly into one of the biggest mistakes people make with these medications. Because once fear enters the picture, many people start changing doses, skipping pills, or taking extra medication without guidance. And that's where real trouble begins. Now we arrive at one of the most common mistakes people make with blood pressure medication. And it usually starts with good intentions, not carelessness, not neglect, good intentions. Because once people begin worrying about their blood pressure, they often start making emotional decisions instead of consistent decisions. And that's where problems begin. These medications are not rescue medications. They're not designed to be taken based on fear. They're designed to work through consistency, the same time, the same routine, day after day, week after week, month after month. That's how they create stable blood pressure control. But many seniors unknowingly turn their medication schedule into a guessing game. Let me tell you about Martin. Martin was 75 years old and took his medication faithfully, most of the time, but every now and then he would forget a dose. If he remembered a few hours later, he'd take it. Then, sometimes he'd wonder if he should take another dose later just to be safe. And whenever he saw a high reading on his home blood pressure monitor, he became nervous, very nervous. One evening, after seeing a higher than usual reading before bed, Martin convinced himself that taking an extra tablet would help protect him from a stroke overnight. It felt like the responsible thing to do. It wasn't. The next morning, he woke up feeling weak, shaky, and unusually tired. When he stood up, he felt dizzy. His blood pressure had dropped lower than intended. Thankfully, nothing serious happened. But the experience taught him an important lesson. Blood pressure medications are not emergency tools for random spikes. They are long-term medications. They work best when used consistently, not emotionally. And this is where many people get into trouble. They see one high reading and panic, or they miss a dose and panic, or they take an extra dose and panic. Fear starts making decisions. And fear is usually a poor pharmacist. Here's what I want you to remember. If you miss a dose, follow the instructions provided by your healthcare professional or pharmacist. Do not automatically double up later. Do not guess. Do not assume. Because what seems like a small adjustment can sometimes create a very large problem. And there is something even more important. Many people spend years focused on one thing only, the blood pressure number. But the biggest truth about these medications has almost nothing to do with a single number on a monitor. It has everything to do with whether the medication actually works for you in the real world. And that brings us to the most important lesson in this entire video, the lesson that changes how you should think about amlodipine, Losartan, and Lisinopril forever. And now we come to the most important truth in this entire video. The truth most people never hear. The best blood pressure medication is not the one that produces the prettiest number on your monitor for a few weeks. It's the one you can take safely, consistently, comfortably, and confidently for years. Because here's what I've seen happen over and over again. A medication can look successful on paper while quietly failing in real life. The blood pressure numbers look great, the chart looks great, the doctor smiles, but the patient is struggling. They're dealing with swelling, they're losing sleep from a cough, they're worried about dizziness, they're frustrated, and eventually they begin avoiding the medication. Not because they're irresponsible, because nobody helped them understand what was happening. Let me tell you about Teresa. Teresa was 71 years old. Her blood pressure numbers were excellent. In fact, they were some of the best numbers she'd had in years. If you looked only at the chart, you'd think everything was perfect. But every night she was coughing, every morning she woke up tired, and every day she became a little more frustrated. She never mentioned it because she assumed she would hear the same thing many seniors fear hearing. Just live with it. So she stayed quiet. Then she started delaying doses. Then she started forgetting doses. Then she began skipping them intentionally. Not because she didn't care, because she felt trapped. That's what happens when a medication plan doesn't fit the person taking it. Eventually, her healthcare team identified the problem, reassessed her treatment plan, and made adjustments. And everything changed, not because blood pressure stopped mattering, but because Teresa mattered too. And that's the lesson I want you to remember. Blood pressure medications are powerful tools. Amlodipine, Losartan, it's Lisinopril, each can be incredibly effective. Each can improve and even save lives. But none of them should be taken blindly. Side effects are not weakness. They are information. Swelling is information. A cough is information. Dizziness is information. Muscle weakness, unusual fatigue, changes after dehydration, unexpected symptoms, those are all messages your body is sending. Your job is not to diagnose yourself. Your job is to pay attention, to notice patterns, to ask questions, and to speak up before a small problem becomes a big one. Too many people believe being a good patient means staying silent. Absolutely not. A good patient pays attention. A good patient communicates. A good patient understands that silence is not strength. Silence is risk, because the sooner concerns are discussed, the easier they usually are to solve. And I want to leave you with one final thought. Millions of people take blood pressure medications every day while living in a fog of uncertainty. They know the name of the medication, they know the dose, but they don't understand why symptoms happen. They don't understand why dehydration matters. They don't understand why certain pain relievers create risks. They don't understand why blood tests are important. And that lack of understanding creates fear. But once you understand the pattern, much of that fear disappears. You stop assuming every symptom means disaster. And you stop ignoring symptoms that deserve attention. That's where real safety lives. Not in panic, not in denial. In understanding. If this video helped you, share it with someone who takes blood pressure medication. There's a very good chance they need this information too. And before you go, tell me in the comments, which medication are you currently taking? Amlodipine, Losartan, or Lisinopril? And what has your experience been like? I read every comment, and your story may help someone else who's going through the same thing. And if you found value in this discussion, subscribe and join us for more practical health guidance designed specifically for adults over 60. Thank you for watching. Stay informed, stay proactive, and take good care of yourself.